Welcome to the Gem of the Week. My name is Dr. Cedric Noel, and today I'd like to talk about memory or cognitive impairment, and Alzheimer's disease. Now, I want to give you a gem that every one of you can apply immediately that can have a strong impact on preserving your brain function, and that is blood sugar. The reality is that the neurons of the brain require three primary things for survival. And I've mentioned this before. One of them is oxygen, one of them is activation, and the third is glucose. Glucose, does that mean that you need more sugar? No, it means that what you need is a balanced blood sugar. We want to go for balance, stability. So if you don't have balanced blood sugar and you have these spikes, these ups and downs, then you have less stability in the efficiency and the metabolism of your neurons, your brain cells, okay? So, and if you've got that going up and down most of your life, it's not a good thing. And so there's an article that I want to highlight, okay? This article is making the connection between blood sugar and Alzheimer's disease, all right? Think of it as blood sugar connection to brain function. It's there, it's strong, and I've recently been emphasizing this a whole lot more in my practice, really just over the past few weeks. And what I have seen with my cases here has been absolutely incredible, where we see a significant difference in neurological function and performance in stabilizing blood sugar, meaning that if I see some patients that have not had food in many, many hours, we're talking more than 3 hours, sometimes 4, 5, 6, or maybe they fasted and they haven't had anything to eat since the prior day. What I'm finding is that if they are given something to eat and to stabilize their blood sugar, their ability to perform through therapy here, but also the way that they feel and their symptoms improve. Now, I want to read just a little bit of introduction here into this abstract so you can see what that connection is. So the exact connection between Alzheimer's disease and type 2 diabetes, it's still in debate. However, poorly controlled blood sugar may increase the risk of developing Alzheimer's. This relationship is so strong that some have called Alzheimer's diabetes of the brain, or type 3 diabetes, okay? So that's not a new thing. It's been kind of in discussion for quite a while. Now, later on into the abstract, it says insulin-related therapeutic strategies are suggested to succeed in development therapies for Alzheimer's disease by slowing down their progressive nature or even halting their future complications. It's so important that we can't leave it out. Remember, it's one of the three essentials for neuron stability, neuronal function, and for your neurons to thrive and function. So one of the things that I can give you right away that you can do, I know a lot of people like to do intermittent fasting. My recommendation is not to keep doing it. You can do it periodically, but not to do it all the time. And some may do better with it than others, but what I've come to realize is that there's a lot of people that do it, that like doing it, but there is a compromise and it's costing them some issues as well. So number one, I would say, yes, there are some products that you can take, there's some supplements you can take, but just look at your diet. Let's start with diet, because if we don't do that, we're making a big mistake. So first things first, within the first 30 minutes of waking, you want to eat something, okay? It could be small, but you want to at least eat something within the first 30 minutes. And then every 3 hours. Now, and some people may need to do hourly, and some people can handle go longer than 3 hours, okay? So that's absolutely true. But if you're in a case or in a situation where you've got some major signs and symptoms, you're working on improving the function of your brain, you want to eat every 3 hours, okay? Now, there are exceptions too, where shortly after a brain injury, it can be very helpful to do some fasting for up to 3 days. Again, talk to your provider, talk to your doctor about that before doing anything like that. Now, of course, we want to avoid sugar because sugar will give you the spikes. So we want to avoid sugar. We want to avoid bread, pasta, cereal, all the grains. That's kind of like sugar. Yeah, it's just like sugar. So you want to avoid all those things. And you want to really minimize fruit, if not eliminate it in some cases. Now, most importantly is that if you are going to have those things that you need to avoid, don't have them by themselves. It's really important not to have them by themselves. You want to have more protein, more fat, and more fiber. Those are the three that are going to stabilize your blood sugar. So if you're going to have potato chips, don't have them on their own. Have them with some guacamole. You want to get some fat in there. If you're gonna have a fruit, try to have it with some nuts or maybe some peanut butter or some almond butter or something like that. All right, I hope you get the idea of how this works. Another important thing, yeah, I think I've hit them all. Yeah, naturally, when you sleep, you're not gonna wake yourself up to eat every 2 hours in your sleep. When you sleep, you sleep. Just make sure to eat something when you first get up. Okay, I hope this was helpful, and this is a practice that you can start implementing. Avoiding sugar, it's not just because sugar can feed cancer a lot faster than anything else, but it's also because stable blood sugar is essential for good brain function. Have a great day.